Our next panel is a little bit different. What we're going to do is bring on 3 guests. We're going to talk about bioconvergence. So from the internet to actually how technology and biology is coming together. And don't worry, if you don't know what bioconvergence is, that's just a clue, one of the first questions. So let me welcome our 3 panelists up to the stage. We've got James Rothman, Melanie Matheu, and Shaun Holt. And I'll start with a little bit of introductions. There's so much to say for all of you. I hope you like that piece that we just did with Vint. So, Professor Rothman, you are amazing. I think most people know a lot about you, but maybe just a couple of things to highlight. In addition to being an actual Nobel laureate, not someone who thought about it, you are a former chief scientist for GE Healthcare. You've been a senior advisor supporting companies at Celesta, and you are a professor at Yale University. And so much to say in terms of who you are, and having met you, I would say, like Vint, you are still incredibly young with so much to share. And Melanie Matheu is a founder and CTO of Prellis, which is a company that started in 2016. And she and her company are really looking at how to bring 3D printing together with tissues and organ replacement. So how do you bring both 3D technology as well as our life sciences together in a unique way? She's a scientist turned entrepreneur, and she is cross-disciplinary. And so when I asked her what that meant, she has expertise in immunology, chemistry, biophysics, molecular biology, and the list goes on, to which I will just say, I did call my sophomore in college and he's studying data science, English, and biology, and I said, keep going, honey. You've got a lot more to study. I just met Melanie, who's doing the most interesting things in the world. And then Shaun Holt, who is the chairman and CEO of Alveo, brings over 2 decades of experience here, and Alveo is looking at real-time molecular chemistry and looking at that together with cloud technologies, which we talked about earlier in the panel, and how do you use those abilities to understand the data for decoding, this is probably not the right word, infectious diseases. And so when we think about that, I think we can all name a couple that we are particularly worried about recently, but it's actually a broader set of innovations. And brings so much science and entrepreneurship. So we have this amazing panel. And I'm going to start with a really simple question to both Melanie and Shaun about bioconvergence, which sounds like a very fancy term that business people came up with. And so I just want to help the audience. How do you define that term, and explain to us why it's so significant? Let's start with you, Melanie.
All right, well, bioconvergence is really bringing together what we know in biological sciences, genomes, proteomes, how cells interact with each other, and the information they exchange with some powerful tools that we've developed recently in ML and AI, right? And so there is so much data and information that really underlies life, how we function, how we even breathe. And being able to encode that and take a look at it from a new perspective in ways that we just aren't able to do as human beings is just incredible. And so I think we're really at the forefront of those 2 worlds colliding with recent advances in each field.
Shaun?
Yeah, sure. I guess before I add to that, I want to thank Celesta Capital for scheduling the event today. This is the best I've felt after a Super Bowl Sunday in a very long time. Secondly, just want to thank.
I actually don't know who your home team was. At least you have to explain who you were rooting for.
Well, I'm a 49er fan,
so
at heart.
So. Local fan. Okay.
I also just want to say thanks for the opportunity. By the way, I mean it's a real honor to be up here. Number one, obviously with the Nobel Prize winner. But one of our female founders of one of our most exciting portfolio companies. So I just want to acknowledge that as well. I think just to add to Melanie, it's not only the combination of the sciences and the technology that defines bioconvergence, it's really about the teams and the cultures that you're bringing in together from all these different fields and expertise. And I think that oftentimes gets lost, and it's very difficult to bring those different fields in and create and innovate and actually just get products to market. So I think while you've got the technology and the sciences, it's also bringing together, all these different expertise. And I think when you do that and you do it successfully, you can, create almost perceived magic in the case of Prellis and Berkeley Lights, I think, which we'll talk about a little bit later today.
Yeah. And Jim, let me ask you, so as context for folks, the bioconvergence market has been valued at over $121 billion. That's a really big number. And it's anticipated to grow to $250 billion by 2032. Why 2032 very specifically? That's a question for later, but it basically is a lot of numbers. And so can you help us understand what is driving this momentum? Why now on bioconvergence?
Yeah, so that's a terrific question. Why now? Maybe we should look back to history because, it's all about the timing. So one of the, bioconvergence is really kind of in a way, it's sort of trivial, no offense to anybody. I mean, it's interdisciplinary. It's about the people from different disciplines coming together as people, as Shaun says, but also in terms of the sciences. Probably the first attempt that I'm aware of at bioconvergence, it wasn't bio at the time, came from Isaac Newton. That's, of course, in the mid-1600s. Now, here's the great man of physics, probably you would say invented physics. Did you know he was also the great alchemist of his time? Okay, he actually had more notes on alchemy than he did on physics, okay? And the only thing was his timing was wrong, right? Because, alchemy, chemistry was not actually invented for another 200 years. Now, if he had actually gotten it right and gotten chemistry together with physics at the time, the whole world would be a different place. But timing is everything, right? So what's happening now is that for really the first time, you see a coming together. I would say probably the main, most recent event in multidisciplinary as it relates to biology is AI, and it's specifically in the form of something called AlphaFold. Have any of you heard of AlphaFold? It's the ChatGPT of our world, okay? And it's like ChatGPT, it's not the end, it's just the beginning, but it's one of these things that just knocks you on your rear end the moment you find out about it. And what this piece of AI has done, it has solved one of the great problems of physics, chemistry, and biology all at the same time with AI. By the way, we don't know how it works. But it has solved it, and you can go directly on an enormous scale, on the scale of all of biology, really, from genes to proteins. Genes are the instruction manual. Proteins are the action. They're the guys that do the things in the cell. And to be able to predict the structure of a protein almost instantly on scale opens up an incredible number of doors in drug discovery, in medicine, and so on. And it's emblematic of the coming together of these disciplines. It's just really the beginning.
It's very exciting. And I mean, that leads to the fact that all of you are driving innovations at this moment. And all of you have projects that you're very humble about when we talked, but I mean, they could change the world. I mean, you're all trying to solve some of the greatest challenges that we have. And so I would just love to give each of you a chance. Shaun, why don't we start with you on what are some of the big problems that you're trying to solve right now?
Yeah, I think we mentioned, a couple things. I mean, obviously the topic today is with, the pandemic that we're exiting out of. There's other looming crises such as, the food crises and things, not enough food, for the world. And I think what we're doing at Alveo is, it's a very simple yet exquisite technology that we've developed. It's a handheld molecular sensor. We talked a lot about sensors earlier today. But the fundamental technology and the way that we're detecting pathogens with this molecular sensor is based on direct electrical sensing and impedance. And so, most of you are technologists in here. You can sort of deduce what that means. We don't need optics. We don't need lasers to detect pathogens. So we can do it at a very low cost. We can do it at very high accuracy because it is a molecular testing device. And it's a very rugged, durable device. Traditionally, when you're performing diagnostics, with PCR and other lab-based equipment, it sits, the equipment sits on a desktop. You can't move it. If you bump it, You get a bad run. And with our technology, I mean, I have a good example of this. I ran a COVID test with our analyzer before I left for work one day. I threw it in the back of my Porsche. And I got a negative result once I got to work. And you couldn't do that with other devices. And so we're going to apply that not only in healthcare, but we're going to move it into agriculture. We're going to move testing more towards the point of need. So now we're talking about testing crops, testing animals, and there you're talking about avian flu and infectious bronchitis in birds and the impact that that's having on the poultry supply in the world. So all of these things are going to be enabled, again, by Bioconvergence and by Alveo Technologies. One more plug, we're actually raising money now too, so I look forward to talking to everybody after this.
So Jim, what about you? What are you trying to solve? What are you most interested in?
Well, one of my favorite projects is a company that I work with, actually as a director and in other ways, called Berkeley Lights. It's a Bay Area company, and it really is taking on very directly one of the core problems in bioconvergence. So, I mentioned AlphaFold and how it helps us scale from genes to proteins. But you also have to go another big step, and that's what Berkeley Lights does, which is from proteins to cells, because proteins work in cells, and obviously the cell is where life and also where disease occurs at the cellular level. And as a professional cell biologist, that's something that I'm very much aware of every day. And what Berkeley Lights does is it combines essentially automation and large-scale imaging, microscopy, and AI to manipulate individual cells and select them according to their properties, and to then in exploring their properties, which we call the phenome, takes us all the way from gene to protein to the behavior of the gene in the cells as a protein, phenomics. And in particular, Berkeley Lights harnesses this for drug discovery in the most rapidly growing segment, which, as I'm sure many of you know, is the biotech portion of the biopharmaceutical industry, meaning monoclonal antibodies, solving key roadblocks in that regard. Another important area that I'm very proud to be associated with is the Celesta portfolio company, Prellis, where I have the opportunity to work with Melanie and her colleagues, but I won't say anything about that.
Well, that's perfect. Melanie, tell us about what you've created and what you're solving for.
Absolutely. So you alluded to tissue engineering and my background in immunology when you introduced me, and Prellis has solved a really interesting problem that was unsolved in tissue engineering before. We're able to bioprint ultra-fine microvasculature, and we can use this to support large tissue structures and scaffolds. And why this is interesting is that we can bring human biology into the laboratory. And so just using a blood sample, we can recreate the human immune system in a dish. And why is the immune system interesting? Well, I first got interested in it because you can argue that it may be really, truly at the nexus of almost every described human disease. There may be a few out there, but really all of them involve the immune system. And it turns out the immune system is the best way to make therapeutics on the face of the planet. We all make antibodies when we're infected with different pathogens. They're highly specific. They are made very quickly. And one antibody from one person can be used as a therapeutic in another person. And so monoclonal antibodies are used in cancer, autoimmune disease therapeutics. In fact, they're the highest grossing class of therapeutics out there. And so what we've done at Prellis is we've recreated that human immune system in a dish so you can discover antibodies, query what the immune system is going to do, how it responds to pathogens, and learn from that, okay? So you don't have to go to a person anymore. You don't have to go into an animal model anymore if we get this right, which I think we're on path. You can actually get all of that data just in vitro, and we're hoping to feed high quality data to things like AlphaFold that will help us discover better antibody therapeutics faster.
That's really incredible. So you're giving us a taste of what's possible, the testing of animals and crops, getting closer to where the problem starts. Melanie, what you just said. So Jim, it's not all roses. Tell us about some of the roadblocks and some of the things that would have to change on path for scalability for what Melanie and Shaun are doing.
Yeah, so that's really an important point. I would say, there are always roadblocks. For me, the single biggest roadblock is sort of continuing on the continuum that I've been painting, is the link to clinical medicine from phenomics and the cell. And probably there, the single biggest risk or roadblock, in my view, has to do with portability and the nature of data in electronic health records. And I'm sure many of you are involved in this area. And you quickly recognize that probably the most limiting feature has to do with molecular status of patients. So particularly I'm focusing on oncology, because something like 2/3 of the clinical trials today for innovative drugs are in the area of cancer. And almost all of those have very demanding criteria to enroll a patient. You have to have meet certain criteria in regards to the mutations and the genetic status of the tumor and so on. And that takes one of our most common diseases down to rather smaller number of accessible patients. And the problem is that the standard types of things in your electronic health record, your EPIC record typically, most of us will have EPIC as the sponsor statistically. There's the structured part of the record, your blood pressure, your temperature, that sort of stuff, when you went in and out of the hospital. And then there's the unstructured part, which are the lab tests, many of them, and the fancy lab tests, like your molecular tests. And so no one has really, to my knowledge, really cracked the problem of how to get that stuff, which is not pre-structured, in a way that's readily searchable on scale. And what that means in practical terms is an enormous disconnect. I've read that there are about 2 million patients each year that don't get put on clinical trials for cancer, potentially life-saving trials, for the mere fact that they can't be found, even though they're out there, in a way that relates to the criteria for the trial. So this is an enormous problem, and it is one that is really limiting, I think, for the whole bioconvergence field.
And Shaun, what do you see in terms of the industry, some of the challenges, but also maybe as an entrepreneur? Tell us about that.
Yeah, I mean, I think, we talked a lot about bioconvergence, and, there's obviously a lot of value from doing things cheaper, faster, better, increasing throughput. When you consider all of those things, it's from an operator perspective, it's about adoption, right? So you've taken a technology, you've got a prototype, you alpha, beta, you're now commercializing it. When you're fundamentally changing the way things are doing, we talked a lot about Berkeley Lights, and single cell biology and drug discovery and cell line development. With Prellis, again, drug discovery. Alveo, taking testing to the point of need, as we call it. It's how do you drive adoption? So once you productize, that's a big lift. Getting people to think differently about, different workflows or different, areas where they, traditionally have done something very manual, but now it's automated via software and instrumentation. So I think that's one of the bigger challenges, is just climbing the adoption curve.
Yeah.
Getting people to change. Yeah.
I think I'm sure a lot of people in the audience can relate to that in terms of going from pilot and early stage into a level of production and scale. Melanie, tell us about some of the challenges the roadblocks that you'd see. What would be on your wish list if you could change? If you could change something, what would?
Well, it's not dissimilar to what Jim sees. I think organizing high quality data and understanding what to best feed forward into these systems, right? Because if it's garbage in, it's garbage out, typically, right? And so, understanding how to apply the machine learning and the AI, the AlphaFold to proteins that are typically very difficult to understand and to generate effectively de novo. There are a lot of groups that have started with kind of blank libraries. They aren't really specific to anything, and we're talking about antibody therapeutics. And you don't really get great hits out of those. Starting with semi-directed libraries and data, I think is going to be the key. But we really need to kind of grind away at that and make sure we're going in the right direction.
And one of the things about all three of you is you come with such deep academic and science backgrounds. And one of the things I wonder is making that crossover from understanding the science, being able to invent the science, being able to see things differently, but then moving to entrepreneurship. Well, actually, it's probably a couple leaps, moving from science to actually also deeply understanding technology and its capabilities. I mean, AI in and of itself and its limits as well as its potential is pretty complicated. And then also saying, I'm going to add one more triple flip on that and be an entrepreneur. Can each of you maybe share your personal journey and some advice that you have for folks in the audience? Maybe start with you, Shaun, and we'll go to each of you.
Sure, yeah. So I think if you look at the current sort of venture landscape and all the investment that's gone into, bioconvergence over the last few years, there's been mega rounds. Every company, Series A, B, C, you name it, was raising 10, 50 to $100 million to achieve their mission and vision. I think in the times we're in now, valuations are becoming more reasonable. Right? I'm talking about from an investment perspective. Valuations are becoming more reasonable. Rounds will become, will likely be lower in terms of dollar size. And so what that's going to do is force, I think, execution, right? So shrinking the timeline from a technology or proof of concept to commercialization. And so, yeah, I think, that's going to put a lot of pressure. It's going to put a lot of pressure on execution in terms of, the use cases, identifying the high value applications, but also getting that right the first time. Without these mega rounds, you can't make mistakes in terms of the product market fit. So I think that's one takeaway for me is just given the current investment landscape, the pressure to, commercialize and drive, a commercialization quicker, I think is going to be key.
And Vind also mentioned that overall in terms of having funding for decades around internet protocols, and for all of you, you're looking at quarters, if not even smaller fractional moments of time. So how we think about time in relationship to these trends. I mean, bioconvergence, as we talked about, Jim, it didn't just happen a year ago or 2 years ago. This is actually something that's been in the making and probably in the beginning stages still. So I think that's a real tension. Melanie, tell us a little bit about how you've gone from crossing that bridge from a scientist to an entrepreneur.
Yeah, I learned I was very impatient with the academic system. I thought I'd be in academia for quite a while, and actually had a grant to go on and start my own lab and be a professor. But I had this nagging idea where I thought I could solve this problem of ultra-fast bioprinting and development of human tissues, and it wouldn't go away. It kept coming back to me year after year. No one else put it into practice. And I took a deep breath and I turned down a grant to start my own lab, and I said, let's go do this. So that was a huge leap. It's probably the scariest thing I've ever done. If you know anyone in academia, we're not typically risk takers. So it's a very different mindset. And I had a lot of phenomenal mentors along the way, and that's what I would recommend is just finding mentors, talk to people who've done it before. It's never going to be easy, but you can learn a lot from other people's mistakes, and that's usually a good way to do it.
And Jim, I mean, you are both crossing the divide or the shift, but also you're mentoring so many up-and-coming CEOs with big ideas. Tell us a little bit about your journey and what do you recommend?
Well, I'm the one person here who never left academics. I still run a very active research lab at Yale, and I run a department of about 400 people, including all the staff. And but I had a wonderful experience in industry, first with Amersham, a British company that was acquired by GE to help form GE Healthcare a number of years ago. And when I was being interviewed for the job of chief scientist at Amersham, they asked me, well, you don't have any qualifications, working on a large organization and running a large research team and doing management, so why should we hire you? And I said, well, we probably shouldn't, but you might consider that as an academic who's accomplished something, in research, I've had to manage without bonuses. I can't fire anybody. I don't have any of the tools, no carrots, no sticks. All I can do is inspire people. And somehow I got hired. So, So that was actually a great transition for me. And by the way, it's helped improve, having spent time in industry has hugely improved my ability to mentor people in academia. I've come to recognize how little, forgive me for saying, actually comes out of academia except for training people. I've come to appreciate the profit motive and how important it is in sustaining innovation in this country and around the world. Everybody tries to emulate us. I've also learned one final bit of advice. After getting the Nobel Prize, I have to say I've been asked a lot for my advice about things. And the only thing I can say is that my whole life, I've actually not taken very much received wisdom. And if for any reason I've been successful, it's for that reason. And the only wisdom I would leave you with is don't ever accept advice from an old scientist. Which, by the way, is an oxymoron if you think about it.
I can tell that people would love to ask questions, so I just want to open it up. I mean, I can hog all the questions. I've got a lot more here, but in case someone else wants to get a word edgewise, we'll just offer, we have mics around, so if there are a couple of folks who would like to answer questions, give people an opportunity. Just raise your hand. Oh, right back there. Oh, two. You and then right there in the back, standing up.
Thank you so much. That was a great panel. My name is Preeti Padmanabhan. I'm an angel investor in a deep tech startup that's manufacturing a brain-computer interface. I'd love to hear your perspective on the future of human-computer interface.
Would you like to start?
Oh, I guess that must be the tough questions. They come to me. Of course, I know almost nothing about the subject as compared to what you know. Could you wave so I could see where you are? Ah, okay, very good. Okay, and you know, one of the things that really impressed me when I started getting into neuroscience, which I work in now, actually, is that when you look at the cortex of the cortical structure and anatomy, whether it be a human or even a mouse, it's actually sort of a two-dimensional crystal. Believe me, this has relevance to the question. And even at the cellular level, there's a pattern that repeats itself of cells and columns. And yes, it's not two-dimensional, it's vertical, it goes through 6 layers. But the point is that it's essentially undifferentiated. So any part of our cortical brain, our new brain, can really be used to process any kind of information. And undoubtedly, it has a secret sauce that we all want to understand. We actually don't understand that. And that, to my mind, is probably the central question that you need to solve, or at least someone needs to solve, in order to optimize the human-brain interface. But the point is then that the bit of cortex that processes vision or hearing or generates a thought of one sort or another, they're fungible, okay? It all depends on how the input and output are wired. There's a huge amount of stroke studies and now optogenetic studies that establish that. And so what that says to me is that the future in your field, the brain machine interface, is extraordinarily bright, as is the entire area, actually, of bioelectronic medicine. But we have so much more to understand in order to really fully develop it. It's a great question.
Can we get a mic? Yeah.
Hello, my name is Aditya. I represent Fourth Sense Technologies. We're a startup trying to raise our seed round. And we work at the intersection of silicon photonics and the synthetic biology. So what's your take on silicon as a platform for doing a lot of conventional things in the wet lab workflows like spectroscopy and stuff like that, and analyzing, right? Silicon photonics is basically now allows you to do the whole entire optical circuitry on top of the silicon wafers. So what is the future for lab-on-chip sort of applications? Thank you.
Melanie, do you want to start?
Yeah, I can start with that. Phenomenally rich future. Silicon makes a great substrate for these kind of experiments, and I think that the smaller you can make it, the more efficient you can make it, right? And that kind of throughput is what we need to isolate the data sets, right? That will give you the information to make the next steps in your discoveries. So I think it's a phenomenal area to go into.
That's great. So for each of you, one of the things for all the entrepreneurs here is a little bit more on the advice side. So as you think about each of what you're doing, what would you leave this group thinking about? What are some of the hard questions that you would throw back to this group, or lessons that when you look back at your younger entrepreneurial self, you would impart on wisdom? Shaun, let's start with you.
Yeah, I think there were some really good points I think made earlier in the session around in today's one of the sessions around the team, the culture, achieving the mission and vision. I think John mentioned having a playbook. I'm 4 months into a CEO role, first-time CEO. But what I've learned, over my 20 years of operating experience, finance and operations, is exactly that: have a playbook, right? So what we've done, and this is sort of my advice, is, it's one thing to have a great technology, and it's like a hammer looking for a nail, or whatever the expression is. But having that playbook, right? Establishing the mission and vision that's compelling. Creating, I think we talked a little bit about core values too, right? Creating core values and building a culture that embodies those, I think is key to taking a concept and really getting it towards, productization and commercialization. So doing that as fast as possible is probably my advice, because, rounds are smaller, and execution is going to be, I think, key going forward.
Maybe just one more poke on that. What would you recommend to someone who's also taking their first time tour of duty as a CEO, specifically? The transition between operating and being the final person.
There is an absolute balance that is required between, executing, but also keeping the company afloat and fundraising. And so I'm learning that balance in real time as well. So. That's why it's just so key to have a great team that can execute, your vision, so that you can allocate more time to raising capital. And
like the 49ers,
getting the story
but
out there.
that's just because we're local fans.
Yeah, right?
Melanie, tell us, tell
Yeah.
us about what you think.
Yeah, so as Shaun said, it's a balance when you're a CEO. And the one skill that I would give to any new CEO, if I could, would be realistic optimism. You have to problem solve. You have challenges that you've never thought of. But as long as you're a realistic optimist about it, you know when the chips are down, you know what you need to do next, and you approach everything with a problem-solving mindset, and you will get to the other side with realistic input. I think really anything is surmountable. We're a tissue engineering company, but we're making human lymph nodes right now. We're not doing livers, we're not doing hearts. We found a phenomenal product market fit and high demand, and so we're headed that direction, right? So I think realistic optimism in any company you start is critical.
Melanie, I love the concept of realistic optimism, certainly optimism overall in the field that you're in. You've had different roles. You've had the CEO role, you've had the founder role, and you've also had the CTO role. Tell us a little bit about how to make those roles work well together and how to create that magic.
Well, I think it's about trusting your team. As Shaun said, team is critical. You need to have a strong sense of trust with your team. You need to discuss the hard things with them as a CEO. You need to be able to lean on them, ask for advice, and all of that comes back to that optimistic problem solving. It's really it's so critical to be able to reach out and say, hey, we've got a round coming up in 6 months. What do you guys think? Where are we strongest? What do we need to execute on before we get there that will show that this company is worthy of persisting on, that we have a good product market fit?
That's great. Jim, tell us.
Well, I kind of already gave you my earlier, but I actually would like to thank you for doing a great job with this panel, and also your previous interview. The only thing I think I'd like to add is how different this meeting. I'm from New York, and when you go to a meeting like this in New York, it's about valuations, capital, blah blah blah. This meeting has been really a pleasure for me to attend and learn a lot from, because it's really been about vision, and there's just I love coming out here because there's something really, you all are from here, so you don't see it probably every day, but there's something super special in the bioconvergence field, to get back to the topic, that's going on right here, right now. I mean, you have one tradition sort of down in Cupertino, more or less around here, of engineering on scale, on surfaces, chips, and so on, and it's diffusing north, okay? And then you have this other tradition that started with Genentech out of Stanford and UCSF, and it's the biology and it's the gene tradition, and it's diffusing south. And you have just a large number of new companies that are, we've heard from a couple of people in the audience and a couple of our companies. This is probably the only place in the world where you could have that type of convergence in the way that, in the effective way that it's occurring here. And so I'm very, very bullish on bioconvergence in just the way that we've been outlining it today, right here, right now.
Well, with that, I don't think there's more to say, but to actually thank these amazing panelists, their time, and their thoughts today. I know there's also, we have 1 to 2 more panels to go, but there's also cocktails after for all of you who want to meet and spend some time with these amazing, amazing guests. So maybe just one more round of applause.
Thank you.
Thank you.